2021 meeting of the Yarmouth Board of Health. I'm Hillary Bosky, the chair of the board. And first thing we'll do is actually just take attendance. Perhaps everyone can just state their name.
Mary Craig.
Deborah Brunish.
Eric Weston.
Is Charlie there?
Yeah.
Okay, Director Murphy, you're here?
Yes.
That's great. Okay.
What do you want?
Just a statement here for remote participation meetings. And the statement here is pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, GL 30A 18, and the governor's March 15, 2020 order imposing a limitation on the number of people that may gather in one location. This meeting will be conducted via remote participation. Specific information such as instructions and guidelines for remote by members of the public and or parties with a right and or requirement to attend this meeting can be found on the town website at www.yarmouth.ma.us. So why don't we get started here? As usual, first item is public comment. If we have anyone calling in or is actually present here, would like to come forward. Now's the
Yeah,
time.
we're just trying to check up our speaker system. Just 1 second, Mr. Chairman.
Sure, thank you.
1 second, Dan. Take your headphones. Good. Okay. Can you hear me now? Okay.
Yes.
Yes.
Okay, good. All right. So the first item on the, I can take my mask off now. Board of Health.
Is anyone calling in for public comment?
No.
No. Okay. So we can just move along. Looks like tonight we have a hearing, and most of it is going to be an update on COVID-19. It's the majority of the meeting. So here on the agenda, number 2, as you can see, is a hearing variance request on septic repair at 45 Prince Road, West Yarmouth. Hopefully everyone's had a chance to look over the property. And why don't we move forward? Bruce, is there anything you want to start off with?
Yes, Dan, do you want me? I'll go and give a little background first before you speak, Dan.
Sounds great.
Okay. What we have is a straight septic upgrade at 45 Prince Road. It's an existing 2 cesspools. It's a tough location of wetlands behind them. What they're planning to do is put a new system out front. They're going to put a new water line in because it would be too close to the septic. So they're going to put a new water line into the house. The house plan is the same number of bedrooms that are in there now. It's 4 bedrooms plus a 1-bedroom studio apartment above the garage. They do have a pump chamber and they're able to get 5 feet above adjusted groundwater. They've mentioned, and they'll go into the variances that they're requesting basically because the wetland is right behind the house and the system is in front of the house, is far away from wetland and towards the front with 5 feet off the front of the property line. And they will have a liner on both sides of the leach field, the front side on the street, which is a catch basin in the street, and then also on the back side towards the house. That's the general overview. The engineer, Dan Ogeler, is available, and I do see the owner of the property is also connected to the meeting. So with that, Dan, do you want to give a little background?
Sure. Again, for the record, Daniel Ogil, I'm a land surveyor and civil engineer with Down Cape Engineering in Yarmouthport, on helping Peter Zorzi, who does look like he's in the audience, if there are any questions of the owner, longtime owner of the property, out with permitting on this piece of property. This is what we call a maximum feasible compliance situation where Title V basically says you take what you have and you do absolutely the best you can with it. And that's generally good enough. It's very rare to deny one of these when there's a capability of pretty much fully meeting
No,
Title V on the property without a, alternately you would go to a tight tank or something like that. But this is a situation where we can make an existing situation quite a bit better. For many, many years, since the 50s, when this was built, there's been cesspools, which are quite close to the groundwater. What that, as you know, can lead to is the effluent being fairly close to the groundwater, and you can get pathogens that'll get into that groundwater and can then get transported out to the navigable waters, possibly getting people sick. So the best system that we have now for avoiding that situation is to do a pressure dosed leaching and to make sure that you have a full 5 feet separation of a nice dry sand underneath that leaching field. And despite all the variances on here, thankfully those two criteria, which DeFeo and Waite in their report did mention, the vertical separation is more important than the horizontal separation. We were able to achieve the full 5 foot separation, and we also took the time to put in a pressure dosing system, which very evenly distributes the effluent out over the entire field. And in that manner, you don't have, sometimes if you do a pump system, you're dumping quite a bit of water right on the end of the leaching field, and it could pond up and perhaps channel and create some soda straws of water down to the aquifer and transport some through a saturated zone, some pathogens. So instead here, similar to a lawn sprinkler, you spread it out over the whole field nice and evenly, and you've got a tremendous separation then of a full 5 feet of sand for the good bacteria to weed out the bad viruses and so forth. There's some harvesting that takes place in the nice oxygenated soils through absorption and adsorption. They cling to the sand and are therefore filtered out and die prior to hitting the groundwater table and then slowly being transported over to the open water. There's a litany of variances, but again, I think the overriding thing is we've got a full-size field that's 5 feet above and pressure dosed. So the variances are, you don't need to be 20 feet from a garage, but where there's a crawl space in some of this, and again, it's not habitable space down there, but there is a little crawl space. We're closer than we need, than is allowed on that. We're mitigating that, as Bruce said, with a liner. That's a vertical separation several feet off the leaching field, which if there was any horizontal transport of effluent, it would stop that and go down beneath the grade of the cellar so that habitable space wouldn't be impacted by sewage flows in the rare instances that happened. On Bruce's recommendation, we did move the water line. We withdrew the request to have that variance. Again, under maximum feasible compliance, you do have a lot of discretion, and the agent felt that it was worthwhile to remove the one variance from this. So we're retapping the main and moving that water line over, so there won't be any relief requested on that. We are a little bit too close to a leaching catch basin. Back in, I think, 84, they replaced a basin in the street with a 600-gallon unit, which we're estimating would kiss seasonal groundwater. So generally, you want to be a little further from that. And even under the state code is 50, we're going to 20 here. But again, we do have that vertical liner. And in the soils, the sands that we hit out here, you generally don't get any horizontal transport. Gravity is controlling and it pulls the effluent down. And yeah, we generally don't have any issues with that. So the liner, I think, could allow the board to make the findings that under maximum feasible compliance, this is the best that we can do in this instance. We have put the field over on the side that's further from the bank. There's a bunch of resource areas here. There's open water, there's a flood zone, salt marsh, coastal bank, but it's all on the seaward side of the house. And with that liner there, and we're maintaining 63 feet from the wetland, which is a salt marsh. The coastal bank is just a big rock revetment. I want to be particularly sensitive to septic flow. but we are 52 feet from that, which I think 50 is the Title V setback. So, again, SAS to lot line, SAS to, that's one that's routinely granted. We're trying to tuck it a little bit further from the house and from other sensitive resource areas, so that's routinely granted to the lot lines. The septic tank to the foundation, a modest request of 2 feet variance on that. It's 8 instead of 10, but again, we've dropped that liner in there, and that's a sealed unit, which normally would not leak in any event. By code, it cannot, and it should not. Reduction in the setback to the drain, which I spoke of, 50 to 20, and setback SAS to water line. That one we can withdraw the request because, as we said, Bruce had us move that water line clear. So it would just be the first 4 variances from your regulations, the SAS to coastal bank, 100 to 52.2, and septic tank, 100 to 54.3 are the 2 variances we're requesting. But again, in terms of protecting the environment, we're doing the best that we can with this. We're moving it as far from the resource areas as we can, lifting it up so it's a full 5 foot, and adding that additional component of pressure dosing, which evenly distributes the effluent and will help protect the sensitive resource areas. So this is, we feel, the best we can do. And again, with working with Bruce, we did a dual compartment tank and a couple little tweaks like moving that water line. And I'm going to darken up the floor plans. The original is clear, but the scan came in light, so I'm going to rescan that a little bit darker on a final print. But I would be glad to answer any questions that you have on this one. Thank you.
Board members?
My only question, and it might be more for Bruce, is did we hear anything from the abutters about this?
We've had no response to the butters. They were notified by certified mail.
Okay, thank you.
And once again, I don't have all the paperwork in front of me, and certainly not on the screen here. The number of bedrooms and baths or what? Because it sounded different than what I recall reading about it.
So if I
But the
could,
floor plan wasn't really there on the plan.
yeah, we had a rudimentary floor plan, which is generally what is required, that was accurate on the first print. The second print, which I know you I don't know if you can see that very well, but there is a pretty decent first and second floor plan that's now available. So I had emailed that directly to Bruce the other day, and we put it on the plan. But the owner happens to be an architect and has got a pretty good hand, but that schematic there is pretty darn close. The bedroom over the garage is actually, you call it a studio. It's a 1-bedroom apartment or a studio apartment, but you refer to that as a bedroom. And that's 100% legal if anyone's questioning it, because it actually withstood an appeal over 30 years ago. It was determined that it was there since the 50s or early 60s prior to zoning, and the neighbor appealed and lost. And there was actually a court case which affirmed the zoning board's decision that was an apartment, it was legal, and it didn't need a special permit. And the Peter Zorzi had actually gone through that, almost 40 years ago. So it's clear that that is a legal apartment. So we've got the dual compartment tank and the appurtenances. And about 33 years ago, he had a septic system design done by a team of Robin Wilcox and Ted Dumas. And they also determined that it was indeed 5 bedrooms. And then now, in looking at Peter's plans, it's quite clear that it is 5 bedrooms. There is a study and some sitting rooms, some little rooms, but there's another test in Title V that you can look at, which is you take the total number of rooms, and I could recite that verbatim if you'd like, but excluding bathrooms and hallways, living rooms, things like that. You count up all the rooms in the house and divide by 2 and round down. And so at 10 rooms, divided by 2 is 5. and and you don't have to round down, but that also gives you the firm 5-bedroom existing. Oh, and what you're probably, the discrepancy would probably have been the assessor's records did have 4 in there, but they're clearly in error, or it's that they're shorthand for not counting the studio as a bedroom, or it's on a separate sheet. But by all measures, it's been quite clearly demonstrated that there has been 5 bedrooms legally on here for many, 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 many years, and it remains the case.
The revised plan that Dan submitted late this afternoon does show that bedroom over the garage, and he's labeled it now studio. So we know there's a kitchen there, and he does show separate stairs going up to it that will be darkened up. So we do have a clearer floor plan layout, Mr. Chairman and Board.
Okay, thank you.
I think one point, Mr. Chairman and Board, is this is a tight system, so I would recommend that on approval, that the engineer inspect and certify, and also make sure we mark out the property line so we know exactly where that street liner is going on the property. And I think that could be noted on the revised plan, because they have to darken up the floor plan. Is that something you can work with, Dan?
Yeah, stake the street line, and what did you say, a certified as-built?
No, just darken up the floor plan and then stake where the street liner is going to go, so we know it's on the property.
Absolutely.
I think just a letter of certification, inspect it, then a letter of certification, because it's pretty much, that's the only place for it to go.
Yeah, they won't drift off much, especially like you say, if we stake out that liner, they'll be right on the mark.
And they can get this all completed within the next 90 days.
We'll be back. We'll come back if we can't. Everybody's really busy these days, but I know the system is on its last legs, and the owner is motivated to get it done. So I think that's very reasonable. And then, but if for some reason we cannot get anybody engaged, I will come back and ask for a brief extension.
Well, should we include that right now and just go to July 1st? I mean, we're getting, 3 months.
Fair enough. Yeah, that would probably be safer. I know you guys have a lot on the plate with the COVID and everything.
Board members have any questions? Obviously, there's not a lot of room, or there's no room there. The only alternative is a tight tank, which we all know what it is and what that entails. That's as I see it, is the only other option. So not a lot here.
Yeah, tight tanks do better with a seasonal use. If you're there every day, they're very expensive. And then you get the honey wagon coming down the street, dripping.
Oh, I agree, 100%.
Yeah, they're tough.
So this is all season home?
Yeah, it is. It's year-round residence. Fully insulated, heated, everything. Yeah.
So you want to make a motion, we can move forward, and there's no other discussion. So perhaps we can move ahead with it then.
I move that we recognize that this is maximum feasible compliance with Title V, the 4 variances as listed.
Good try.
I'm sorry?
No,
Oh,
I'm
okay.
sorry, go ahead.
Okay. And also the 2 variances under the town septic regulation. We are going to require that the engineer inspect and certify by letter after this has been installed. And also before that, that the street be marked to stake out where the liner on the street side is going to go, and that the work will be finished by July 1st.
Thank you, Mary.
Can I just ask one thing? And we're striking the reduction in setback SAS to water line, right? That last piece?
Correct.
Yeah.
They moved the water line further away.
Sorry, Mary.
Need a second to that motion.
Second.
Thank you, Deborah. And any further discussion on it before we vote? Charlie, anything? Because obviously we can't see you. Bruce,
Nope, that's fine.
nothing from Charlie then?
Charlie, he supports it. He was
Okay.
trying to make a motion earlier, but we couldn't get the voice to work on it. He supports the motion.
Okay, thank you. Okay, so all in favor, you can just say aye and raise your hand so we can all see it. Let's see what the vote is. I'm voting
Aye.
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 Okay, so it's unanimous. Okay, that passes. And
Wonderful. Thank you very much for your time. I appreciate it very, very much.
as usual, thanks for coming in. It was really very clearly stated. Thanks. Okay, the third item here on the agenda is an update, as I said, on the coronavirus. Director Murphy, it's your stage.
Okay, let's get the Zoom Master Meredith up on the process here. Okay. So as of last Friday, overall, since last March, there was 1,103 cases. Currently, as of last Friday, we were down to 32 active cases within town. And recovered, and we're really going to be changing that to is released from isolation, 1,053 cases. And we're up to 29 deaths, and I think we had one death last week that we went from 29 to 30. Okay.
Bruce, I had a
Yes.
question, although I know there's a further slide, but 4 of the deaths have been at Liberty. Is there anything going on there?
No, not that we're aware of.
Okay,
We can still see its community spread between West Yarmouth and South Yarmouth. And then it's also based kind of on population, whether that's the higher areas in town. So it's not in one particular place, a nursing home or a business. It's what we would call community spread, continuing. Our Friday totals that we follow each Friday, obviously we can see that it's slowed down over the last several weeks, where before we were getting probably 15 cases a day. Now we're down to 4 to 5. So you can see the totals have just gone up a little bit. By age group, it's still coming out as higher between the 50 to 59, but you can see we only had 2 cases over a week. So that's kind of slowed down in that area. It's not kind of all slowed down a little bit. And then you got the age 20 through 29 went up 4 cases. And 30 to 39 went up 6 cases. You know, that's an area of our workforce, and that's the area of families that, you know, have children in the school that we still need to continue to take precautions with. As we go down, we can see how it's spread between male and female. Still, females getting more of the cases. Okay. These are the daily cases that attract, and as we can see, the number of daily cases that we had at any particular time in May was approximately 40. And then it went over to the summer. And then, as we can see up in December, we had an active of almost 170, 80 cases one day. And as we can see, it's coming down now. And we'll be able to see that on our state chart coming up in a minute. Oh, wait. That right now we're down to about, what we say, 32 active cases. So it's coming right down, staying right here. So what we say right now, we are on the backside of the surge. Okay. The state view of all the Cape Towns came out on each Friday, and we can see Yarmouth in the back at the bottom at 3.49% positivity. We're in the yellow for our fourth consecutive week, which is very good. Prior to that, we were in the red high-risk category for 8 consecutive weeks. But you can also see all the Cape Towns are now out of the red high-risk categories, which was only a few weeks ago that there were 10 towns in the high risk. So you can see Cape-wide, it's decreasing. Our numbers of total testing is also coming down, where we had tested about 3,000 people over the last 2 weeks. We're down to 2,000 now. And we believe some of that is because the nursing homes have all their residents and staff tested, or residents tested, and a majority of the staff tested. And some of them are not on the state requirement of testing 3 days a week. So we're seeing less testing. So we've been right about the 3.4. It says a little higher. I think we were at 3.3 the week before. So it's a good trend that we're moving, and we saw that from the earlier slide that we're on the backside. So we still have cases. People still need to be cautious, but overall, the whole Cape is on the right track. Hospitalizations, I don't know if you can slide this over or move our pictures to the side. Or you can see it on this one, okay. It doesn't come up. Is the 25th the last day? Yep. So based on this is an update from the Cape Cod hospitals, both Cape Cod and Falmouth. We can see based on the 25th on the far right, in Cape Cod Hospital, there were 12 COVID people in beds, with 2 in ICU, 2 at Falmouth Hospital, 1. So that's kind of stayed up a little bit for the 22nd, but down from February 8th and February 15th, the first 2 months in February. So we've even seen, hopefully, the strain less on both hospitals. Okay. Oh, you know what? This one. Okay, yes, the deaths that we saw, this went up to 30. We had 3 in February. Yes, we had a couple in the nursing homes, but we've also had, the last one was at Cape Cod Hospital. So we don't have all the data on it, so we don't know these people that have passed away at Cape Cod Hospital if they were in a nursing home first. So
Is that something we can get, Bruce?
I can look at digging into it. I mean, when the data comes to us, it just has the last place of where the person was. So I could see if it's in Maven. I'm not sure, but we could take a look at that. Okay. I put this chart back in. I don't know if it was in your board's pack, but I put it back in. Precautions people need to take. And I can't stress enough that to the public that's watching this, we put this in every week. It's up on everything we talk about in Channel 11, is to avoid gatherings, dinner parties, birthday parties, sleepover, play dates, carpooling unless it's a family member. You need to wear a mask. If you don't feel well or waiting for a test, stay home until the tests come. Do not go to school or work. Just this week, we had a couple at a birthday party now that we have a couple positives, which means the kids aren't going to school and the parents aren't going to work because the kids are too young to stay home by themselves. So people are still holding parties. They're still having gatherings. I just can't stress it enough that we're still seeing positive cases. So to try to stop the spread, mask up, social distance, wash the hands. So we'll go from there. Interesting enough, I think on Sunday's paper, one of the first page article is the long haul towards recovery. That many of the people, what they're saying is once they've had COVID, about maybe 50% or more are still having symptoms after they come off. These symptoms can range from body aches, shortness of breath, coughing, headaches. So we're hearing a lot more of that, and that's why I changed that on that earlier slide from recovered to off isolation. But from talking to people that have still had or coming off COVID, there's still some symptoms that they're struggling with. And I thought this was an appropriate article. This was a lady from Marston's Mills, 56 years old. But we do have other cases of people even younger that are experiencing symptoms even after they've been cleared from not carrying their COVID. Okay. Interesting, at the bottom of this, still on page 1, was a bill to bring more COVID money, CARES Act money to Cape Cod of 65 million. And we'll see some of that out of that 65 million. We'll see 24 million is supposed to be going to Cape Towns. So we'll be able to use that for either town additional signboards, staffing. We'll probably need it when we start to do homebound people that are looking for vaccinations that can't get out to a clinic that are requesting coming. So we'll be working with the fire department and their paramedics as vaccine becomes available. So I thought that was 2 interesting stories on the lead for Sunday. But you can see, just going back up top, 50% of the people, even 3 months later, are still getting side effects from COVID. Okay.
The point is, you don't want to get it.
Yes, I think that's the most important thing. I think some people might think, oh, it's just like the flu and I'll be fine. But there's a lot that you can still get 3 months afterwards, and it's more than just the flu. And some of these people are very some of them still have a lot of symptoms afterwards. And they find out that, you can see it on the left, between headaches and difficulty sleeping, that I talked to somebody today and they've been cleared for at least 3 weeks now, and they're still getting headaches from time to time. Okay,
It's scary.
it is. Okay, vaccine. What are we on the vaccine front? That's the question that we get every single day, and we work on the office every single day of what we can do to get more vaccine. So right now we know we're down to, the governor's moved it down to age 65. But if we look at in town, in Yarmouth, we have 7,000 people, 7,500 over 65, and we haven't even finished vaccinating the people over 75 that wanted to get a flu vaccination COVID shot. Of the approximately 4,300 people that we feel we have in town, we weren't even to, we don't know what the number is, but we know we're not even close to that number before the governor opened it up to 65. Which just means more people trying to get on the COVID sites to get a COVID shot. And the first day they went down to 65, the state site crashed because too many people were trying to get on. So it's making it more difficult for the people age 75 and older. They have limited, some of them have limited computer skills, so it's difficult for them to get on. They call the 211 line, the state line for assistance, and sometimes that takes 10, 15 minutes, and sometimes by the time they get on, it's been closed. And some of those sites that they go to, they want them to send them to Gillette Stadium or Fenway Park. It's been difficult trying to get anything on the local, closer on the local. Okay. So vaccination plans, what we're working here on in Yarmouth is we're still working with the county health departments who's Difficulty is only receiving 975 total doses per week from the state. And right now, out of that 975 that are coming in, almost all of it is being used by people that need their second dosage. So that's the difficulty there, that there's really not first dosage available. There are 4 to 5 ongoing regional sites that's been ongoing with the county that we've been working with. And again, they're going to be used for second doses. The good news is the one mass Cape vaccination site that the state said a week ago that they would not have. They've kind of rethought their position, and with a lot of calls and lobbying from our state senators, Senator Sears and our representatives, have pushed the governor to include one large mass vaccination site at the community college. That will put the smaller regional sites on a hold for now. So that will be helpful, that we'll be able to get more vaccine and try to get more people vaccinated over the next couple of weeks. People can still try the local pharmacies here on Station Ave, South Yarmouth, CVS in East Falmouth, Walgreens in Hyannis, Stop and Shop, Hyannis and Howard, but these are also filling up very quickly. Okay. So we see the mass vaccination site in the works. This was on Friday's paper. Julian Sears that they're hoping to get the 4-seat site up and going to do 4,000 doses. That would be this week. I'm not sure they're up to that, but that's the direction that they're trying to work towards. Okay. Just another article that was in the paper that they're going to get ready for the community college site vaccination. This is a photo of it when it was set up for a testing site that was up there earlier for several weeks. So this was outside. They're hoping to use the Cape Cod Community College gymnasium, that people will be able to go inside in this weather, and it'll make it easier on the vaccinators that they're not out in the weather. So that is something that appears to be very close. We hope to have more information this week.
Bruce?
Okay. Yeah.
Bruce, I just want to mention also that the governor has changed his mind and is going to be sending vaccine to hospitals and healthcare systems again. So that's another resource that people might have and should take advantage of if they are contacted by someone from their healthcare system.
That is correct. We do hear that the governor just released some to hospitals. I know Cape Cod Hospital is going to get some. The question isn't clear how they're going to get their vaccine out. I know the last time they called some of their patients, people that they knew were in need. And a lot of it is also going to go to people that need a second shot. So the hospital will be in the mix.
I can speak to that because I just had my second dose today through Cape Cod Healthcare at the Cape Cod Community College. And yes, they called the people who had their first doses February 1st, 2nd, and 3rd at the Cape Cod Melody tent. So I think once they get through those second doses, they will probably be using any vaccine they have for opening up to people who need first doses again.
Good. I'm sorry, did you say you went to the college today?
Yes.
And how did that go over there?
It was great. It was supposedly going to be drive-through, but of course it was raining. So when we got there, they asked if we were able to walk, a short distance inside, which we did, and they had the gymnasium set up. And it's spacious, and it was cold, but it was dry.
10 stations,
10
3 working,
10 stations and only 3 working for what they needed to do today,
no waiting at all.
and no waiting at all.
Good. Well, that's good to hear that that's up and running, and hopefully they'll get additional dosage that they'll be able to get a lot more people through for their vaccinations.
Right.
We are still working on discussions on homebound people, how we can get them vaccinated, and we're trying to concentrate on the age 75 and older. We've been in constant daily contact with our senior center, Diane Kane up there coordinating how we can do that. She at the senior center is getting about 50 to 80 calls a day from seniors. Difficulty of signing up, can't get online. So she's got a list going, which is working out very good. So we can try to get them over to the community college as needed. We were also working with Harbor Community Healthcare of Hyannis, and they had received some vaccine last week for us, and we coordinated with Harbor Community Health of Hyannis, our senior center, Diane Kane, and we're able to come up with 40 people that we could bring over there Friday. We used the bus from Cape Destinations that donated their bus to bring 20 people over. It was 15 people on the bus that had trouble driving, that were 80 and 90 years old, that appreciated the ride down so they didn't have to deal with the traffic. So we're hoping that will continue. We did get other people to drive, so that was an all-day project last Friday. We worked with the bus out of the senior center, greeted it when it came into Hyannis, and we plan to do that again this week also. They're hoping we'll find out this week how much vaccine is being delivered to the community health center and whether we can do it another week. We're also, yep. Oh, we're also in discussion with Outer Cape Community Healthcare on getting vaccine for our senior housing on Winslow Gray. VNA still doesn't have any vaccine for their homebound patients they work with. We're hoping that some of the new vaccine that Cape Cod Hospital receives will be directed towards the VNA, as VNA is part of Cape Cod Healthcare, that they can start getting some of their homebound. So I have a feeling that some of the homebound is probably going to be more towards the end of February, because I'm thinking we probably really need that new Johnson & Johnson that's come out that we just give one shot to, so we can keep moving right through the homebound and or homebound assistance, that we figure there's probably 300 or 400 people that we probably need to reach out to. We did check the number of people receiving Meals on Wheels, and most of them said they would like to have a shot if available. So I think that's the plan we're working with on a couple of the community centers on that. The last mile was, I think I touched on something at our last meeting. It's a group that's done a pilot program up in Quincy of providing vaccine for homebound people. And they do pop-up clinics that we're hoping they could do a smaller one at the seniors. They just received approval from the state just for their pop-up clinics. And they were only licensed to go to the 20 communities that had designated minority demographics as based by the governor. They have not been approved for their last mile homebound at this time. They're hoping to get that possibly by March, at which time they would further discuss a possible test site within Yarmouth. So I know it's taken a while to get the homebound, but it's something I want to let the public know. It's something that we work on and discuss every day and try to keep our communications open with all these people. And we're doing the best we can to keep that on the front burner with us. Okay. Notifications, how do we get all these notifications? People want to know, how do we get it out to them? Our social media platforms, whether we get it out on Facebook, Channel 18, we'll get it out there. We do have the line that we'll be establishing up at the senior center. It's going to be try to be manned by 4 people, just so they can talk to people and call them if we need it. The county has a helpline. There's the code red calls that I put out in the newspaper. So as we go forward, there'll be plenty of opportunities for people to get a message. And it will be ongoing. So it's not like, oh, I just missed one clinic they had up at the community college. They're hoping to run the community college 5 days a week. So I think once the vaccine becomes more available, you'll see more appointments at a closer location. Okay. So the state number that I mentioned earlier is the 211 number. They will assist in scheduling an appointment if you have difficulty. I know it takes some time from what I've heard to go through that, but that's the state number. Unfortunately, most of the numbers or locations they give you is off Cape at Gillette or Fenway. Dartmouth, the new Dartmouth site filled up very quickly.
Bruce,
Yes,
when the Cape Cod site is open, that can also be accessed by 211.
that is
correct?
correct. That is correct. Okay. Got the county number here. So people can also get it on themselves if they're looking through maimmunizations.org. They can look for their own site also if they're on the computer. If not, they can call 211, or they can also call the county helpline. Yeah, 774-330-3001 is probably the best number to call to find the status out on the county assistance through the Cape Cod Community College. Okay, so we still need to get more vaccine. I put this in that I'm still pushing for vaccine. It's a good background that I used for Channel 7 the week before when we're on the news with several other towns saying we need more vaccine on the Cape, how frustrated everything is, that we're still pushing forward with it. And I think that did help as a small part to help the governor understand the need for more vaccine on the Cape, along with our Cape delegation, Senator Sears, Representative Whalen, Kippy Diggs. So I'm sure that all helped. And it's also that we're looking for some vaccine to be provided to the town so we can do smaller clinics at the seniors, or we can take the clinic, or we can take some of the smaller vaccine and do homebound ourselves. So we still need to keep pushing that. And just a couple articles that came with that was the frustration of Cape officials for Baker vaccine. That was on the February 12th. So you can see since then, I think a lot of the calls and everything that went up, the governor did reconsider to get more vaccine and open up a site at the community college. So with that, I think that ends up before we get to the next one is stay right on the fest. No, go back to frustrated. Is if anybody has any questions on the whole vaccine status right now. Good?
Great.
You're muted, Mr. Chairman.
Sorry about that. Yeah, maybe just give us a brief summary on changes that started today. There's some loosening of restrictions in restaurants and so on. Anything you can share with us?
Yes, I didn't put any slides in on that, but today from last Thursday, Friday, the governor did ease up some of the restrictions based on the percent of positivity decreasing. Restaurants are no longer at 40 to 50%. They can open up to 100% as long as the tables are 6 feet apart, which they were over the summer. So that should work, and that helped the restaurants. They can use plexiglass in between to help keep the 6 foot spacing. So I think that's good news for the restaurant people. I think that's probably the biggest thing. They also are increasing the outdoor gathering limit from, remember what that was? From 25 to 150 to 50.
I think it was only outdoor, it was not indoors.
Right,
Not
right,
indoors,
just outdoor.
Right.
So, and then that's going to be opened up again further to large venues like Fenway Park and Gillette, that they're gonna allow them to go up to 12% later in the month, and that might even increase a little bit more as baseball season gets a little closer. They might allow a few more at Fenway Park. So they have taken a few steps that I think will be helpful opening up some of the businesses. Anything else?
Bruce, one question, I had some concern, as well as Mary mentioned about the, over at the Liberty. What happens with the nursing homes and testing and for people who have been vaccinated? How is that handled?
Say that again, Mr. Chairman, your thought?
About what they do about testing of people who've been vaccinated. Are they tested or not? In other words, the employees as well as the patients. Do you know what happens there?
That I'm not sure 100%. I know they're doing some limited testing still at the nursing homes, but not testing everybody as they done in the past. They've kind of narrowed it down.
Okay, thank you.
Anyone else?
That was, Bruce, that was great. Thank you.
Okay,
Anyone?
very good. Our next event that we're going to go to is our annual White Ribbon Event Day that the Health Department works with Independence House and the Police Department. And I'm going to have Meredith just give a little update on that. She worked with it last year with Mallory in the office. It's going to be a little different this year, but she can give you an update on that. So I'll give that to Meredith. Can you hear Meredith?
So White Ribbon Day, it's an international campaign that began in Canada. And the population they're targeting with this kind of campaign is men, and they are urging men to be part of the solution in ending violence against women. So the idea is that men will take a pledge to not participate or in any way contribute to it, and they actually want men to actively work against violence against women. So today they had an event with the head coach of Holy Cross Crusaders, and it was a lot of student athletes, mostly male football players with their coaches, and they were in all the local high schools, and they just had a big Zoom meeting with all kinds of discussion. And I heard from Annie Catalano at the police station that it was really great participation all around. They had some good talks. The kids were interested and participating in the discussion. And then tomorrow, there's a second part where the Yarmouth Police Department will go live on Facebook, and you can talk with the Chief Frederickson, and you can have questions and just hear about their role along with the DA and Independence House, any questions on how men can participate or take a pledge or actions they can take, or just everyday, tips that you can use to help end the violence against women.
Ask any questions.
Does anyone have any questions?
I have a question about Independence House. I know that I've seen some newspaper articles saying that domestic violence has increased during the time of the pandemic. And I'm just wondering what Independence House's experience has been. Did you hear anything about that, Bruce or Mallory? Meredith?
No, we just heard the same as you, that it has increased, and they're still open and staffed and available as a resource for anyone who needs it.
Yes.
Okay, thank you.
Okay, so I guess we'll go to the next.
Meredith, thank you.
Yeah.
It's great.
What?
We're up to agenda item number 8. There's a county human service grant.
So the VACC, which is the Yarmouth Substance Awareness Committee, has applied for a grant with the county. It's called SAPSI, and it's the Substance the Substance Abuse Prevention Commission, we've been awarded the grant for $2,500. So we're going to be working with Duffy as well as the high school and middle school to work on a visual art project. So we're going to choose 25 students with the help of the teachers and faculty in those schools who maybe could identify some students who would be interested. And the students are going to be given a budget of $100 each, and they're going to create a piece of art or a video or, you know, however they want to express themselves, something that represents what addiction and recovery means to them. And the goal is to actually display this art. We're hoping to work with the Cultural Center to have students put their art up, and we also want to do a digital art gallery for those that would like to remain at home and socially distance. And we're going to ask the students to share their perspectives, what it's like living with either substance use themselves or having family members or just anyone in their lives who has substance use disorder. So we hope to engage the students and the greater community in discussions about the impacts of substance use disorder, because there's definitely been a rise and a lot of people are struggling. There's all kinds of resources available. So we hope that this will open up a greater discussion, all while reducing stigma. We want to provide education as well as awareness to those participating and anyone who wants to just follow along and watch. And we're going to also have information available about resources and other things on the Cape that people can reach out to, groups, organizations, and we hope to get a lot of press coverage. We can go on Facebook, all kinds of social medias, on Zoom, and have a digital gallery, as well as actually having it at the Cultural Center. And we're going to have this done by the end of May. So we're hoping to have the art gallery displayed somewhere near the middle to end of May.
Sounds great.
So we're really excited.
Thank you. Okay, we're up to number 9 here, and it's new and old business. Director Murphy.
Old business, none. We're good. We're just old business, new business, kind of same thing. We just spend all day working on COVID precautions, trying to get vaccine for the homebound people that haven't been able to go out. So that's kind of where we're at. The next Board of Health meeting will be March 15th, 2 weeks from today. And we hope to get the tobacco cap discussion at that meeting at that time.
Okay. Anyone, any questions, thoughts? Now's the time.
Compliance has been okay, Bruce? No problems?
The what?
Compliance with,
Better. We did get one call. The landfill seemed to be better, but we still had some people or a couple people without mask up there. So we're still trying to be vigilant out there to try to keep our community safe out there.
Certainly encourage people who've been lucky enough to get vaccinated, they still should be wearing a mask.
Yes. Good. That's all I have, Mr. Chairman.
Okay, thank you. Anyone else?
I just left this up there for people at home at the end, Charlie Baker, just to, if they want to call him, if they're having trouble getting through the 211 line and want to talk to the governor, say we
Good
need
luck.
more vaccine on the Cape. I've called a couple times and haven't got any answer back, so.
just
You
leave
never
a
know.
message.
Yeah,
Yeah, leave
I
a
left a
message.
message.
Director Murphy, is that a home or office number?
It's his office. I haven't quite got his home number yet.
Okay, fair enough. Okay. Anyone, as you say, anyone want to go home? So, anyone
move
want
we
to make a motion to adjourn? This is it.
I move we adjourn.
Second, someone?
Second,
Okay, all in favor, say aye.
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 Charlie?
Yep, he's an aye.
Very good. Adjourned. Okay, stay safe, everyone. Take care.
Have a good night.
Good
Thank you.
night.